Thank you very much.
Good morning. How are you?
Excellent. Thank you.
So, Dr. Miguel, I'll just start with the introduction and finish off. So, for the audience, of course, I am Shashi, a certified metabolic health coach from DLF in India's first and only award-winning low-carb, founded in 2014 by Anup Singh, who is an IIT engineer and a silver medalist and also Icons of India awardee. He also pioneered the low-carb movement in India. And Anup had a very unique concept of 100 grams carb per day max protocol, which he developed in 2012, which made low carb very, very easy for type 2 diabetics and especially for the vegetarians. In 2020, he also launched DLF Diploma course, the only legally tenable course approved under the NSDC Partner, Government of India, in the segment with the world's largest CPD hours of 144 hours. So Anup and I, of course, co-organized the India's first conference in 2023, second one in 2024, and now in 2025. So today we have Dr. Miguel Casali. So Dr. Miguel is a physician based in Ireland with a strong focus on metabolic health and low carb nutrition. Passionate about preventing and reversing chronic disease through lifestyle intervention, he actively promotes evidence-based dietary strategies to improve metabolic function. So Dr. Miguel is also involved with CSC Connect, working to bridge the gap between conventional medicine and nutrition-driven health solution. His insights into low carb and real food approach makes him a key voice in the global metabolic health platform. So today we are going to discuss a doctor's journey to metabolic health with low carb nutrition. Doctor, again, welcome.
So thank you very much, Shashi, for inviting me to a great conference, and let's go and talk about this fascinating topic.
Yeah. So first we'd like to know about your own personal story. What brought you to low carb nutrition as a mainstream doctor?
Well, as many of us, it's a personal journey first. This personal journey comes from the different problems in life, and finally going to not controlling what you eat. We call it food addiction, and this affects to many things in your life, ending in high blood pressure, obesity, all this, and probably also mental health problems. Started my own journey. I decided for different reasons in my 45s, I don't want to live like that, and I want to look for what to do. I started my journey is like all of us, starting with different kind of diets, and finally starting to understand the world of fasting, starting to after some jobs of about fasting, after the Nobel Prize published by New England Medical Journal, opened my mind as a doctor to new trends in the world, watching videos like conferences like these, videos like people from Diet Doctor and other people already pioneers on all that, and started to open my mind. And finally, when I started myself to fast and to feel the brightness and to feel the feeling able to control the hunger, that's what my definite like, wow, this is the way, this is the place, this is where I want to be.
So what you started was fasting, more on the aspect of fasting.
Well, I explored different diets during years, and was open to different articles and news in medicine. And there is an article in New England Journal of Medicine. I don't remember exactly after the Nobel Prize in 2016 to the Japanese about autophagy, and for the doctors, we can talk later. We are in a very rigid framework, and to open this framework, we need to read articles who other scientists has published, and this is one of the articles that opened my mind about fasting. And you say, oh, this is the New England Medical Journal. This looks official, because we doctors, we look for official things, like to be able to do them. And I tried it. I tried fasting. I started fasting. I was first time after many years losing weight with a lot of energy, time consuming, cooking, buying many things. I started to see it's maybe simpler. Maybe it's a question of not eating in this 5 times a day, 50% carbs was what I started to see. It was a completely different approach, and I felt immediately the brightness in my mind and how you feel a different level of energy. And this is when I started to continue and started to watch more videos, review other articles, starting to be in contact with Dr. Angwin's work in UK, and then thinking though I want to go deeper and to have a better understanding, and also you start like to grow sunglasses when you start see patients differently too. After your own journey, you see your patients differently. And you see, oh, maybe the problem is here, not so much in the cholesterol, and more in the hunger, in what is not allowing you to stop eating. These insulin spikes, this glucose metabolism, and you start another understanding, like glasses for the metabolic truth.
So in the spectrum of low carb nutrition, so you have been on low carb, ketogenic, and did you also try carnivore diet?
Well, yes, you try different things. I think you never can tell this is the end stage of my of my search. We always continue exploring, and after I think there is an interesting moment when you think you have already sorted. I've got it, and now I can just fast and eat whatever I want again. And I did it for a while and was a disaster, of course. And after that, I tried, and I explored the carnivore diet when I was in Ireland. It's a great country to eat carnivore for a while because meat is excellent, eggs and dairy products are very good, quite affordable. And I tried. I told myself, why not trying? And again, it's another stage in feeling great, simple diet, mental brightness, energy. And started to practice carnivore diet like regularly, not every day, not strictly. I eat many other things, but I also think it's an option when you feel safe when you go to carnivore, because it's, in my experience after many years, the lower carb grams a day, the easier for me to control hunger, and the easier for me to be bright and have more energy.
So now this program is also on the addiction part, addiction to processed food. Were you addicted to some processed food earlier? How is it? I'm very curious to know. Did you have a personal journey of addiction?
Yes, addiction is, Gabor Mate says, addiction is any behavior you have, you know is bad for you, and you are not able to stop it. And definitely this is a behavior I was having, and I am prone to have. So yes, addiction is, for different reasons, is linked with very deep, I think, very deep areas of your existence, and self-damaging, and other questions deeper. But sugar are there. They do things worst as you start feeling good dopamine related symptoms with sugars, and this and then you need to eat again and again, and so this is yes, my personal journey is also comes from what is considered addiction, as you eat more than what you need to eat. I think, and why is a difficult topic. It maybe it's for other session to think about why we human beings do things are not good for us. This is related with addictions, but definitely food. Different foods have different power regarding your addiction to them. And definitely. Finally, the low carb keto diets is where you find the refuge, where you can find the place where you can have the tools to believe you can live without this addiction.
You have been on both the side. Earlier you were mainstream and only drug only doctor. Now you are in the nutrition part. Why? What is stopping many of the doctors to recognize this nutrition pattern has a benefit, and what stops them from recommending this?
Well, on one hand, I have to say doctors, most of the doctors, all doctors, we look for the best of our patients. We look for the better, and sometimes it's a question of access to the information. And I see it's very difficult at this moment to access the information if you are only at seeing the main guidelines and also I can tell it's very important for general practitioners, family doctors. We used to be advised by specialists cardiologists, nephrologists, focusing the disease, not in the prevention. So I think now I can say after very brave pioneers in the 2010s mainly, the science is there. The science is powerful, and so now for some reasons, also. We know the reasons why the reasons are there, and things are going faster than the reality. I think the guidelines change slower than the science and the trends, and so now I think we live in a very accelerated world, and mainly after COVID, and things are changing a lot, but the guidelines are not changing so fast. So it takes longer to change. So on the other hand, I think the traditional biomedical model comes from the disease approach, and it's great for disease to treat patients with diseases, but it's not focused on the preventive approach, and it's more advised by these specialists, mainly cardiologists. This is secondary prevention when the disease is there, when the artery is damaged. But we shouldn't. I think that the primary prevention is different and has a lot of science about what to do and what not to do in primary prevention. And I think it's a question to look for the right information.
So, what kind of challenges have you faced once you adopted low-carb? And did you get pushback from your colleagues?
Yes, the main challenge is inside your own mind framework. As you are used to think, you relate something with good, something with bad, and you have it in your mind and in your training, and it takes long to change your mind. And the challenge is as I'm telling you, the challenge is people open to read new things, open to read things, thinking differently. And I think I found, sadly, many colleagues they even don't want to read new articles, just want to think same. And this is what in the moment they open to read and to practice different things, it starts to change. But as myself, it was difficult for me to open my mind to this different framework. Also, my colleagues, I find sometimes is like, oh, if it is true, I have to change so many things that maybe I don't. Only if someone up to me or my manager or other people tell me to do, I will do. But in the meantime, I prefer to keep the guidelines and not explore myself, not to be risky to do new things myself.
I think most of the practice are, of course, guideline based. So people don't like to break away from guidelines, I guess. So till low carb becomes mainstream and comes in guideline, it's going to be difficult, I believe. And how is your practice right now? Do you still practice conventional medicine plus low carb, or is it only low carb?
Well, I have an integrative approach. I mean, low carb is one part of the things that can help to people, mainly with diabetes, metabolic syndrome, intolerance to carbohydrates, and probably food addiction and other things. I think low carb can help, but general practice is huge, and family medicine is huge. So I have an integrative approach where integrative means integrate the general practice, official, regular prescribing practice with the new trends. And the new trends in nutrition, new trends in exercising, new trends in neuroscience, new trends in art prescription, in expressive. I mean, I am a general practitioner, family and community oriented, And the low carb has been important in my journey, but and I think is something we have to offer for lifestyle for every diabetic, every metabolic syndrome, every insulin resistant physiopathologically disease like PCOS, maybe infertility, of course, obesity, and so many things we know are related with insulin resistance. But the general practice is not only that, but this is maybe 20-30% of our routine job is related to macronutrients advice. I think this is the clue. We in family practice, in general practice, we advise about macronutrients, and this is where I think we need to integrate low carb as a part of the macronutrients advice. But as I'm telling you, my approach is very integrative, holistic, and I also public health, because I know India is completely different in terms of a health system. In Europe, we have public health systems quite strong, and for me, it's very important to integrate also the public and practice approach. Public and private approach.
So tell us more about CSC Connect. What exactly do you do?
CSC Connect is a family business, a family company started after 3 of our parents died, my wife and me, in the last 4 or 5 years. And this energy and a vision of my father-in-law telling we are one before dying, like connect the world, connect the people. And CSC Connect, I think, wants to be an integrative approach company in health, with a global vision, with 3 different brands, like metabolic care. That means all what we are talking about, the metabolic health, is extremely important in our integrative approach. Also, unfolding is a mental health, where we are linked also to India, because it's very, very inspired in Advaita traditions and of the existence, who we are and who we are not. This is and also we believe a lot in the expressive arts, and also CSC Connect is our personal and professional experience. My wife and me, my wife coming from education, and also to integrate everything we've lived in our life, and also it's a talent hunter company, where we believe if we link with the new generations, with the new talent, and we train them, is when we can really build new projects. Without connecting with the talent, without connecting with the new generation of doctors and professionals in general. So it's starting. It's a very ambitious and we are really thrilled to start with working with it. I hope also we can do things in India and in other countries. And CSC Connect has just a 1 year existence, but has some projects in Spain, some projects in Ireland, and is also inspired in the Indian tradition. Our logo is done in Bangalore, in India, where we have been in some conferences, and so this is our CSC Connect enthusiastic project.
So what are the kind of metabolic disorders you see? Is it primarily diabetes, or is it also concerned with weight, hypertension, autoimmune? How is it? What do you see?
In every practice we see very similar things. Of course, diabetes is huge proportion of patients. 70% of the patients admitted in hospitals in the Western countries have diabetes. So diabetes is linked with chronic kidney failure, chronic heart failure, which are the two in the 50s diabetes, 60s, and lately chronic kidney failure, chronic heart failure are very routine. Patients consuming a lot of time in the practices, attending a lot of consultants, a lot of places. And previous to that, you see, of course, metabolic syndrome is there. is already there. And I think you realize metabolic syndrome, of course, diabetes is linked with what is called now low-grade inflammation or even open inflammation regarding any inflammatory autoimmune diseases. But you realize most of the patients with many symptoms coming to the practice are around the metabolic syndrome spectrum. And of course, but lately the time consuming are these patients with the coronary artery disease, atrial fibrillation, cardiac heart failure, chronic cardiac failure, chronic kidney failure, and of course the frailty. I think also the frailty is very. You see the quality of life can be less if your body is frail and your mind is frail. Of course, the dementia we know can be also linked with all that, and this is what we see in our routine practice.
See, in India, we in our lot of population, we see a lot of micronutrient deficiency, like vitamin B12, vitamin D, and iron deficiency is huge. What about in Ireland? Do you see much of micronutrient deficiency?
Yes, we see mainly iron deficiency, anemia. We see also megaloblastic anemia, vitamin B12 deficiency. Yes, we used to see, and vitamin D here is a must. You have to take supplements in the winter, and we see vitamin D deficiency, but probably as we eat a lot of meat, eggs, and dairy. Probably vitamin D is not so severe because the nutrition is maybe better than in India. But the main now we are starting to look at magnesium here, but in the general practice, maybe folic acid in some cases with the pregnancy, but it's not our routine general practice approach. Is focused mainly in iron, vitamin B12, and folic acid. No more than that, and of course vitamin D is now is something we start to understand. But as the guidelines also in Europe, they don't promote the screening of vitamin D in the population. So no, are not routine screening blood tests in the population, neither vitamin D nor vitamin B12. We just check the fluid blood count and see if there is anemia or other things like vital function. We check, but not screening everybody, all the population. We don't do these blood tests only when we suspect some problem.
I think that's one advantage we have in India. We can easily get this test done at a lower cost, and then we do see a huge amount of deficiencies. Now, in Ireland, do you find there's a huge addiction to sugar and processed food? Is the local population too addicted to it, or how is it? Is consumption of sugar very high?
Yes, if you come to Ireland sometime, hopefully, you will find when you go to a petrol station, I suppose it's the same in every place. You have to go, and before going to the cash to pay your petrol, you have like so many colored and options to have different kind of sweets. And of course, for the patients, when you tell them about sugars, it's like, oh my God, I knew that. I didn't want anyone to tell me because I knew it was the problem. And the other day it was very funny on one hand, because one of my patients is dying with chronic heart failure and chronic kidney disease, and was very happy, full of sweets, her bed, smiling like, wow, I'm going to die, but I have my sweets in my bed. And you say, oh, it's definitely when you talk about that, many patients and say, I can't do that. Very, very interesting. The other day, some Bangladeshis coming here. They were looking for a pregnancy, and she had PCOS. Polycystic ovarian syndrome and infertility. 1 year looking for a baby, and when I told her, it's maybe you have to cut your sugars. And she was started to cry. But finally, after talking to them, I convinced them because the husband had a fatty liver. And I convinced them after 3 months dieting with keto low-carb diet, they got pregnant. They have their pregnancy. And you say, so, but was for her so hard to think about, I have to stop my sugars. So it's like people know it's linked with emotions, it's linked with I can't do that. They feel weak. I think it's the word is they feel weak when you face them with the cut down sugars.
Do you have any other memorable case studies, or you have some patient who has shown very significant improvement?
Here, just in the practice I'm here from 1st July, for example, a Ukrainian lady with very difficult explaining to her because she doesn't speak English, just with the translator Ukrainian English. She started with her diabetes type 2 first diagnosed, and following, of course, the advice of David Unwin and all these leaders, you can get the remission 70% if it is in the first 2 years of diagnosis. I explained to her, even with difficulties with the language, and after 3 months, she has reduced and is in non-diabetic HbA1c. Other cases, very interesting, people asking for Ozempic, because here is not licensed for weight loss. And many of them want you to prescribe, and I can't do because I am an official prescriber. I can't prescribe Ozempic because it's not licensed in Ireland. And she finally told me, you are talking to my husband. We have started paleo carnivore diet. I don't need Ozempic anymore. I'm losing weight. I'm not hungry. Thanks very much, doctor. So these are the kind of stories you can do if you are constant, because for me, we have to offer to any diabetic the option free for change in lifestyle. I'm telling them what are the science, what is shown, how can you revert, put in remission this disease, and also, of course, before going for insulin, the patients who are going badly controlled. So if you work in low-carb diets and offering the patients constantly, you get all these successes very easily, as you know very well.
I think it's amazing stories. I mean, in spite of all the restrictions and all you have, you don't, I know it's not very easy for you there. It's all unlike India, where I'm comparing with India. I know when some of a patient wanted ivermectin, I could easily send it from here to you, whereas you have a lot of restriction there. But still, I think amazing job and amazing stories you have with whatever available resources. And I think, what is one message you want to give to India, considering the fact that the current situation here, the kind of metabolic health we have? What would be your advice?
My advice to India. Wow, my advice to India is, I think in India, metabolic health is extremely important. I think my advice is think in your mind, not only think in your body. Think metabolic health strengthens your mind. And I think India is a master in mind for the world. And I think people in India can show the world how we all can improve our mind, our powerful capacity. And I think you are an example of that. And I think people not think only in your body, think very importantly in your mind.
Anup is here. Anup, you want to come in and say something? I think Anup may be out. Okay, fine. So I think it's a good story, and it's your own personal journey of changing your health, your metabolic health, overcoming your own addiction. All this inspires us to know that a mainstream doctor is now supporting low carb, and he has his own inspirational journey. So we thank you very much, and we will continue our collaboration with each other. And what message do you have for Metabolic Health Conference and D-Life in the final?
For Metabolic Health Conference, so continue spreading the voice and opening the mind of the world.
Thank you. Thank you, Dr. Miguel. We'll keep meeting and keep communicating with each other. Thank you very much.
You're welcome. Thanks very much to all. See you soon.